And we are live, and we're also going to be taking some questions today. I am live
Mm,
with Mr. John Hoover, who lives in Texas. You
yeah.
recognize him from a conversation that we had before. And today we're talking about a subject that a lot of people are afraid to address, especially people who have been uh, afflicted with it, and that's post traumatic stress disorder, otherwise known as PTSD. So I'm entitling this talk PTSD: What Works, What Doesn't, and Why. Welcome to the show today, John.
Thank you, George. It's good seeing you again.
Yeah, we've had a nice ongoing friendship through Twitter, some great communication, and uh, I know that it has taken a lot for you to be able to encapsulate your personal story rather than just feel it, to encapsulate it and be able to share some of the things, go as deep or as personal as you want. That's up to you. Uh, and talk about your experience with PTSD, what works, what doesn't, and why,
Hmm.
modalities that you may have dabbled with that really provided no relief. Speak to the men who might be experiencing it and they just don't know what to do. They're alone. Well, let me ask you this real quick. What is one of the characteristics of a man with PTSD?
One of the things that his family, other than mood changes, maybe having anger, depression, one of the things is isolation, withdrawing. You will withdraw from people, your family, um, and you will isolate yourself. And that, in and of itself, can cause a lot of problems. I mean, um, you don't want to be in crowds. You don't want to go out. In my case, I had severe anxiety attacks, and I had a couple of anxiety attacks in public. And one was in a grocery store, and you feel like everyone's looking at you, and people don't understand what's going on. And, uh, I couldn't get out of there fast enough. Um, Large crowds, sudden noises. Um, you know, so to avoid that, you would isolate yourself and withdraw.
Mm-hmm.
That's
What
one of the
happens? What happens during self-isolation? What are what are some of the things that a person experiences when they self-isolate?
well, first of all, you're cutting yourself off from any kind of support, help, friendships, loves. Um, your depression will worsen. Um, you will no longer have the contact of others. And so that lack of contact, George, can really cause a lot of harm um, over a period of time. I mean, this isn't like, oh, I'm going to go and be alone and get in my head and think this through. You won't think it through. You're hiding. You don't realize it.
Yeah.
Okay. And so those are some of the things that can happen in self isolation. The depression comes in, and during self isolation over a long enough period of time, or combine that with insomnia, nightmares, uh, you get in some dangerous territory. It's in that isolation, deep isolation mode that's suicidal thoughts will enter your head. And because there's no one there and you're not around anyone, there's no one there to intervene. And so, you know, 22 people. It's estimated 22 veterans a day commit suicide. And a lot of them have PTSD.
It's interesting, like there's the child that disobeys and the parent says, go to your room.
Mm.
And as an adult, you have nobody saying, go to your room. But when you have PTSD, it's almost like you are telling yourself, go to your room.
Mm-hmm.
It's
In a
this
way.
self-imposed isolation. And it's a
Yeah.
mixed bag, isn't it? It's like you don't want it, but you want it.
Mm-hmm. Let me back up a little bit. Let me talk a little bit about the simple, and of course, I'm a layperson. You got your master's in psychology, and so explaining it to people from a lay thing, the biomechanics of, if you will, of PTSD. What happens is you go through a traumatic event, often life-threatening, and so the parasympathetic side of the brain, fight or flight, right? Or flight, freeze, and flight, logs that as an experience. It's like, okay, I got through it. This is what happened. Okay. That doesn't date stamp. Normally, what would happen is you would absorb that. It would go into the parasympathetic. Parasympathetic moves it over to I'm going to call it the filing cabinet side of the brain. It gets filed and put away for later reference. And it becomes a memory key. In PTSD, that transfer, if you will, is interrupted. It's blocked. And so that event stays in the parasympathetic side of the brain where it is not date stamped. And so it'll play on a continuous loop. And so something will trigger that, it pops, and you're off and you're going. And oftentimes you'll get just the adrenaline, and I call it the adrenaline roller coaster. And because the body will produce adrenaline for about 20 minutes. That's about all the body can tolerate of adrenaline. After that, chemicals in your brain start kicking in to bring you down. You've heard of the adrenaline dump. Okay. And so you got this high on adrenaline, then all of a sudden, boom. And then all of a sudden it kicks back in again. And so you're like this all day.
Is that an emotional up and down or an energy level up and
It's
down?
both. I mean,
Mm-hmm.
uh, with PTSD, you can have flashbacks. I've had waking flashbacks where I was actually in the event, in the moment, sitting in a doctor's office.
Mm-hmm.
Oh, it scared the hell out of the people around me. And, I thought, and so, the symptoms of PTSD, and I've made some notes here. And the journal, right?
That's good.
Very important tool. And so, and looking at it, going through what they call the DSM-5, which is the diagnostic and statistical manual for mental disorders. This is the, if you will, the official guideline that doctors, psychologists, psychiatrists will use.
Right.
And so you can have, for chronic or complex PTSD, which is symptoms over a period of a month, okay, you can have nightmares, flashbacks, intrusive thoughts, avoiding of situations and environments, i.e., the self-isolations we were just talking about. Hypervigilant, hyperarousal, insomnia, sleep deprivation, and anger issues. It's a wide umbrella. Okay, it's a wide umbrella of symptoms. When I was finally, after I had the event in 2005, and it was related to the work I was doing. And I was targeted at my home, and with basically an IED, letter bomb, package bomb, and got my 3.5-year-old son involved. I was home alone. My wife was on conference out of town, come banging out the door. Got a 3.5-year-old Spider-Man blankie, briefcase, coffee, right? And there was a package by the door. And without thinking, I picked it up. Got Sean in the car, got everything loaded up, opened the package. I'm staring at 2 wires like this. Okay. My heart, I think, literally stopped at that point.
Let's clarify. You were involved in law enforcement at the state and federal level.
Right. Joint Terrorism
Investigating.
Task Force.
Yep. Investigating, auditing, going deep with a lot of things that we won't even get into today. Some very national security issues.
Mm.
And you encounter a package, which is a bomb, at your front door while you are holding your 3-year-old son in one arm and a coffee and briefcase in the other.
Spider-Man, and yes. I'd put him in
Yeah.
the car, in his car seat, and it was hot. It was June. I had the doors open. I opened it up, walked out into the yard, used my body as a shield because I was worried it would go off. And I figured if it went off, I would absorb the blast. And everyone came. It was on national, the local station had a helicopter in the air. They fed the CNN and everybody.
Was this a box or like an envelope with like C4 in it?
Like a legal sized envelope.
Mm-hmm.
And it had what looked like plastique, C4, as you said. And it was just a very bad day at the office, let's put it that way.
Yeah.
And it went on all day. And the fallout from that event was as traumatic and brutal as you would care to ask for.
How long was that day for you?
36 hours.
And let me, I know we talked about this before. I'll pull some details out of you. It was a hot Texas day. How hot was it?
It got into 100 plus. I was because I had to strip out of my clothes and everything. I was put into a Tylon, like a painter's suit, hazmat suit. I lost 11 pounds that day and was suffering from heat exhaustion. And it was just a bad, rough day. And it just kept going.
You didn't know at any moment if those contacts would make contact and you would just be vaporized.
Well, I figured when I was over it, I knew I would probably be killed. Once Sean was removed from the scene, I stretched out and got as low as I could. And I figured I would probably lose my hands, maybe my face, if not my life. Then the bomb squad showed up and got me off the package. And that was about almost 2 hours from initially finding the package till the bomb squad got me off.
Mm-hmm.
So that's its own story. So after that event, obviously,
Did you freeze? You talked about, fight, freeze, flight kind of thing. Tell me where
mm-mm.
you were on that spectrum. What did you do?
I would have to say I was like in fight mode. I was defending my son, um, trying to defend myself, but in a way, and this was part of the cause of the PTSD, there wasn't anything I could do. I was kind of
Mm,
married to that package. And until the bomb squad got me up, because I didn't know, looking at this, if the fuses had to contact, were they proximity? Was it a fake and there's some idiot down the street with a cell phone getting ready to punch my number in? Or, plus as it got hotter through the morning, a grease spot developed on the envelope. And if you know anything about C4 plastic explosives, nitro based especially, they'll sweat. And once
yeah.
they start sweating, they're unstable.
Yeah. My first year of college, I studied letter bombs for a whole year.
Okay.
Know
So
it well.
you know what I'm talking about.
I know exactly what you're talking about.
And so you see that little grease spot start. And my explosives training was in my commercial diving days. And we
Hmm.
trained underwater demolition and used
Yeah.
P4. So anyway, back to PTSD. So, and it doesn't have to be, a lot of combat veterans and a lot of people in the combat theater have developed PTSD. In the current environment we're in, you can see where EMS, first responders, law enforcement now, we've had riots and protests going on for over 104 days in this country. And so all the policemen on the front line, have to put up with the abuse, things being hurled at them. There's been several hundred injured and maybe 4 or 5 killed. Um, you have the hospital staffs dealing with when the COVID was coming in hard and people were going into ICUs, and it was wall to wall chaos in there, and not a lot of happy outcomes out of the ICU in the beginning. And so, and then just people absorbing this
Yeah.
and being around it can trigger maybe a milder form of PTSD. And
So PTSD is not what they call autopathogenic. In other words, starting in your head. It
mm-mm,
actually starts with an event. Something has to happen. This is not something that someone can say, oh, come on, snap out of it, or it's all in your head. It starts with an event that actually happened. You experienced it. You absorbed the experience at the molecular level, so to speak.
mm,
How does one deal with an event that is now part of their body? You now are wearing it. You absorbed it in the same way you absorb food. It is now part of you. What do you do with that pain and the instability and the darkness and the self isolation? How does one begin to self diagnose, or is that even possible? Do you need an outside clinician to say, you know what, I think you're suffering from PTSD? Did you have any hunch that that's what you had?
no, to be honest, I thought I was going crazy. I didn't understand. All of a sudden, I had anxiety attacks. All of a sudden, I didn't want to be around people. You know, um, it was my son's pediatrician that diagnosed me.
Mm,
And she worked a lot with traumatized children and abused children. I had taken Sean in for a routine visit, and she was in the room, and of course I'm in there with him. He's a little guy, And she pulled me to the side and said, "John, are you okay?" And she knew what had happened because she was contacted by an agency to let them know what was going on. And I had also spoken to her about it to keep, you know, an eye on Sean. And so she pulled me off to the side and said, "John, I think you need to see a psychologist. I think you might have PTSD. You're exhibiting some things, you know." And she'd known me, you know, she'd been Sean's pediatrician since birth. And I used to take him to the doctor all the time. And so she knew me. And so, and then it was about really 5 years after the event before I got formally diagnosed.
Mm.
Now, in that 5 years, I developed physical symptoms. You're depressed. And of course, depression can cause physical pain. I was in tremendous amounts of pain. So all of a sudden, I'm on.
Where were you in pain?
My
Like
back,
physically?
my back,
Okay.
neck. I take stress in the neck.
Mm-hmm.
And so I was referred to pain management. And next thing I know, I'm on Oxycontin, hydrocodone, benzodiazepines,
Mm-hmm.
antidepressants. I was numb. I was absolutely emotionally numb. I mean, George, I was on hydrocodone and Oxycontin and lorazepam, big doses at the same time.
That's quite a cocktail.
I mean, that's like stage 4 cancer patients.
Sure.
I mean, and this was daily. And it was on it for years.
That's making you a man that feels nothing.
You don't even, I mean, yeah, you have no. My father died in that era. Not one tear. Not one.
So how
Yeah.
many years were you treated pharmacologically for this?
10.
10
10
years. That's a
years.
long time.
But then, now there was psychological as well. And I started out with EMDR,
Mm-hmm.
which I had to write that one down. I mean, I should know it, but just to make sure we get it all accurately. The EMDR is the eye movement desensitization, desensitization and reprocessing. And it's basically you hold something in your right and left hand, and you go through the event in minute detail. And signals were sent, and you would squeeze these, and supposedly it helps reprogram the brain and move that event over to the other side of the brain so it can be made into a memory. That's kind of a rough way to put it.
Mm-hmm.
Sorry about that. But
How long did you try that?
about 6 months. And I was just like, because like you're going through the event in minute detail, so it drags it back up.
So that falls into the category of what doesn't work. What other
Not for
things did
me.
not
I
work
mean,
for
for
you?
me, when I say things don't work, let me put a caveat out here. For me, some people get
Right.
relief. So I'm just going to, I'm not making a blanket statement across the board.
Sure.
Okay. So, and the thing that was disastrous about that is it would bring up all this, goo, all this rage, hate, everything coming up, all the emotion coming up. And then all of a sudden, the psychologist looks at their watch and goes, "Oh, our hour is up. You okay?
Mm-hmm.
See ya. I got a patient
Mm-hmm.
waiting." And you're just, and you go home and you're, oh, Everything okay? Oh yeah, don't you think everything's okay? Do I look okay to you?
Yeah, right.
And
Let me ask you this. Now, during this time, the context is this. You are a husband and
and a
you are a
father.
father.
Hmm.
Yeah, at this time. How did it affect your family life?
Killed it.
Hmm.
Killed it. She didn't know how to deal with it. My wife. She didn't know how to deal with it. Then it got to a point she didn't want to deal with it. I remember a time when I tried to hand her a book. It's called The Sword and the Anvil. Very good book about families who have loved ones with PTSD, and about this one particular soldier's journey through PTSD. He became a psychologist after the war, after he got out.
Hmm.
And good book, good book. I tried to hand it to her, and she just slid it back across the table.
Hmm.
That was hard.
As far as fathering, how was your parenting affected?
Well, when you isolate, and you're not finding it, and you don't want to go out, and you don't want to be out, um, it was hard to be there.
Hmm.
I was there, but I wasn't there.
Hmm.
Um, of
What
all the
other modalities did you try after that? We went medication, we went EMDR. What else did you try that didn't
talk
work?
talk therapy, um, change medications. They would change medications on me. Oh my God, you're on stuff.
Hmm.
Um, they were giving me a blood pressure medicine and apparently it's an off-label use. Is it reduces supposedly reduces nightmare. First time
Hmm.
I took it, I crashed. My blood pressure just dropped through the floor.
Mm.
Okay, on top of everything else, Oh, that's great. Thanks. Um, and so this went on and around, and I isolated and I withdrew more. Um, I tried to work and I couldn't. Um, my health deteriorated. I put on weight. Um,
And you didn't have the kind of job where you can just go to work uh, and mindlessly just work on a conveyor belt. Your job requires
I was,
analyzing.
well, my investigative job went away shortly after that incident. I was asked to resign. Uh, You know what? Asked to resign. You
Yeah,
know, when you work for an elected official and you bring heat, I
yeah,
became the sacrificial goat.
yeah.
So I tried getting work. Um, because of my diving experience, I parlayed that into hyperbaric oxygen therapy
Hmm.
and went to work for a facility here in Austin at a hospital. And that didn't work out so well. Then I took a night shift position as a boilerman at the university in a cogeneration plant. I would go to work at 7 in the morning, get off at 7 in the evening, get off at 4 in the morning. And, you know,
So eventually,
it was a mindless job. I mean,
which is what you needed at the time.
a trained monkey could have done the job.
Yeah. Is
you
that
know.
demeaning?
Yeah, of
How does
course.
that,
I
yeah,
was I was one of the top criminal investigators in the Attorney General's office.
yeah.
You know, educated and hard worker, good work ethic, and put in a situation where that's actually frowned on, right? And I had the head engineer goes, "You can't be smarter than me," kind of comment.
Mm-hmm.
And so, um, so yeah, that was the meaning. But work's work, you know.
Mm-hmm.
That's you do what you do, and things just it was hard.
Yeah.
It was hard.
Then you eventually encountered a therapy that you told me about that I had never heard of.
Ah,
And
yes.
um, was that an experimental therapy? When did it start coming about? Was it uh, covered by insurance? Is it recognized as a valid form of therapy? Talk to me about, explain what it is to the audience, what you experienced with it, everything from when you walk into the doctor's office and the procedure that they go through, and then the effects. Give me the before, during, and after.
Okay. First, let me start by saying in 2018, I said enough is enough with the meds, and I got off everything. So there was a year of withdrawal, basically. Came off the OxyContin, came off the hydrocodone, came off the benzos. That was rough. That was rough. And what I found is as I came off the opiates, my nightmares exponentially became worse.
Hmm.
Um, and so I was hearing about alternative therapies for PTSD. There was the MDMA therapy going on at Johns Hopkins, a study there, and MDMA is ecstasy. And
Yeah,
they
I was going
it's
to say like a hallucinogenic kind of thing.
and
Hmm.
it was they gave you a massive dose and had psychologists there, and it's sort of, for lack of a better term, it'd be like a guided uh, specific psychedelic trip, but it
Hmm.
had a lot of promise. It was showing some
Hmm.
really good results, but because MDMA is a Schedule One narcotic, illicit
Yeah,
drug, it's illegal,
sure,
and the only
sure.
people that can get it have to be approved, and it's not out there. Doctors were substituting ketamine, or out on the street, it's known as K. Ketamine, which is a sort of, I guess, a uh, pre-anesthetic
Hmm.
pain and memory um, medication. Uh, and they were doing it with ketamine because ketamine was legal and the doctors could get it. But it doesn't work on the same level. It affects different receptors, is what I've been told. And so I was watching Joe Rogan, of all people, his podcast one day with Dakota Meyer. And Dakota Meyer is the Medal of Honor winner out of Afghanistan. And Dakota was talking about his PTSD, and he mentioned that he was getting SGB, Stellate Ganglion Block injections from a doctor in Washington.
Stellate Ganglion Block injections.
And that is the nerve to the parasympathetic brain, I
That's
guess.
so where on the neck would the
It's,
injection go? About
oh,
halfway down your neck?
the injection site is actually in the front of your neck. They go through the front to the back.
Oh,
Okay.
okay.
Yeah. they put you under for that one.
Hmm.
And they bathe the nerve with an anesthetic,
Hmm.
and it slows the response down. It does that, and it basically helps reset the sympathetic side of the brain, or parasympathetic side of the brain. And so I saw this. I started researching into it. Talked to my psychologist about it. She hadn't heard about it. It was uncommon. The procedure itself, the stellate ganglion block, has been around for about 40 years and is used in pain management. So the procedure itself is not a new procedure. The application of it for PTSD is what's new.
Hmm.
Okay. And how it came about was this doctor in DC. He was a former Navy. Had been a Navy SEAL. Went on to become an MD. He was treating patients and doing the stellate ganglion block, and noticed that since a lot of his patients were vets, those with PTSD showed really remarkable improvement. And so he commissioned a study, got that going. You know, got some funding, and it's taken off. Now, my insurance covered the procedure. I didn't ask the doctor how he coded it, but it covers it.
Let me ask you this. What kind of doctor does this? Is this a neurosurgeon? Is this an
No,
orthopedist?
I had a anesthesiologist / pain doctor.
Okay.
Okay. And of course, he'd been an anesthesiologist and a pain doctor, so he understood anesthetics. He's great with a needle. He had worked on me before, and he had always been outside the box a little bit, looking at alternative therapies, looking at the latest things coming down the wire and staying current, as opposed to just the cookie cutter. Here are your pills. Let's do some shots. Pee in a cup. We'll see you next month, man. Pain management stuff. Don't get me started about pain management. I do not have a high opinion of that profession as a general rule, and professionally or personally. So anyway, I went and saw him, and I'd actually called his office to see if they did anything like that. And he actually got on the phone with me and said, "John, wow, I've been looking into this. Are you looking to do this?" And I'm like, "Yes, I am." And he goes, "I can see you tomorrow." A week later, I'm on the table. And I had to get...
They knock you out, right? I mean, it's like you're going in for a colonoscopy. They just put you out.
It's twilight sedation.
Okay.
And, it's not the deep. It's twilight sedation. And there's a reason for this. And he gave me a good one. He goes, "John, I don't want you laying up looking at me when I come at you to your neck with this giant needle. And for one, and two," he goes, I need you very still. Because we're going to be going by the carotids and doing some things. And it's not brain surgery unless I slept. And yeah, it's kind of a sense of humor that way.
Yeah.
And so I need you still. And they use a stethoscope. They're in there. They got the scope on you, so you can see, pinpoint exactly. And of course, they do an MRI first, and then they come in.
Sure.
And during the procedure, and their scope. It's a simple procedure. It takes about 20 minutes.
Did you feel anything?
Nah. The only pain was like the little prick in my hand when they put the needle in for the anesthesia.
Okay.
And I knew I'd had some procedures at this place before, surgical center, so I kind of knew the crew there. And so joking around, always joke around with the anesthesiologist, and it's like, "Man, I want the top shelf stuff. I want to see green lizards running around the room." And he goes, "I have enough of you, buddy." And lights out. And woke up in recovery. Piece of cake. The only side effect I had, and a curious side effect, I developed hiccups for about 2 days.
Interesting.
And they said that happens. You get spasms, and because they're in that nerve, and they give you a muscle relaxer, and boom, your hiccups are gone. You
Yeah.
know.
For the audience watching, a ganglion is a bundle of nerves. Just picture it as a. I'm
Spider
trying to
web.
think of the. Yeah,
I,
I
they
think like
describe.
I like looking at it as a like an aerial view of a Chicago highway with all the roads going around. It's like, yeah. And you said they bathe the nerves in this anesthetic. Do you know what the
Hmm.
anesthetic is? Any idea what that is?
I'm sorry, I don't.
Hmm.
I can find out and get back to you with that, but not during the course of this show. But I can definitely call Dr. Frank and ask him, and he'd tell me. And
How fast did you experience relief after getting this? Number one. Number
in
two,
recovery,
how often do you need to have this done? It's not a one and done deal, is it?
no, I felt relief in recovery.
Is
Okay.
that right?
Mm-hmm.
You literally felt better walking out of the place. By
Mm-hmm.
the time you were on your feet, there was relief.
Yes.
But it wasn't that drugged, that
No,
hydrocodone
no,
type of
no,
thing.
no. There's none of that at all. I mean, the only drugged feeling you might have is a little post
Okay,
anesthesia.
so it
You know,
wasn't lethargy.
no,
Okay,
no. And, now here's how
describe describe your thought processes after the procedure.
I was
How were
so,
the gears turning?
gears were turning smooth. I was happy. I just like, wow, you know, rainbows and unicorns, man. It was good.
Okay.
And
Hmm.
here's how we set it up. My psychologist did a baseline before I went in for the procedure. Okay, she did a reevaluation and got a baseline. So we had a baseline to work with. She reevaluated me after procedure. I got about maybe 40% relief. We went in again 2 weeks later, did it again, got up to 70% relief.
Mm.
Once again, baseline, post, reeval, went in third time, and baseline, reeval, got up to about 80%. Now, this is not a cure for PTSD. Okay, let me make that clear. What it allows you, it reduces those anxieties and feelings that allows that psychologist, it gives you the maneuvering room for the psychologist to come in and do what needs to be done. You're more receptive to that therapy, which is going to be the therapy that's going to really help you long term.
Hmm. Hmm.
Okay. So now the effectiveness is about 6 months to a year. I'm in
Mm.
month I'm in month 7. Okay. And the effectiveness is starting to wear down. It's starting to wear off. And I know that because my nightmares are coming back. I'm having insomnia issues, um, and everything. And so we're talking now about going back and doing it again. Except now, what my doctor he's been ongoing research and everything. This time, instead of bathing the nerve, he's going to deaden it. Okay, now deadening doesn't mean like it's going to be just like inert. He just basically, the way he described it, he goes, I'm going to stun it. Okay, I'm going to actually go in there and stun the nerve. And then
And
that'll
not allow the electrical impulses to travel. People need to know that nerves are like pipes,
conduit, the electrical conduit.
conduits. Hmm.
And so, and by that it's slow. It doesn't negate what that nerve does. That's an important nerve. And what it does do, it slows things down. and that's what happens. It slows.
Hmm.
It doesn't destroy. It just slows everything down on that response.
I'm looking
And
at a message, a comment from Jacob Mundy. He says, "Yes, that is when medication alternatives shine, when they are used as a way to get you to a baseline so that you properly deal with the underlying issues." Would you agree
yes,
with that?
absolutely, 100%. The, for example, going back the opiates, SSRIs, benzos, that's a piss poor band-aid.
Hmm.
All you're doing, that doesn't treat jack. Okay,
Right.
it just covers it up. All right. And then even that becomes ineffective. So that's when you start drinking. That's when you start smoking dope. That's when you start doing other things on top of what you're doing. All right. Just trying to get that relief, trying to keep the pain away, trying to keep the demons out of your head. Okay. And that's where guys lose it. I would say at that point, a lot of guys self
So,
medicate. They don't understand what's going on with them and they self medicate. They turn to
yeah.
booze, they turn to drugs, and because they don't know. And
So this is,
that's
go
why
ahead.
this is important to get out there, that things are out there that are effective, that keep you in the game, that keep you with your family, that keep you from isolating and withdrawing. And if you
So let
are
me
there,
ask you
can
this
bring
then.
you out.
Let me ask you this. If you found this type of therapy early on, would the outcome have been a little bit different? Would your domestic
Oh,
experiences, family experiences, job experiences be different if you found this back then?
oh yeah. It'd be like jumping off the cliff with a bungee cord. You whoa, okay, we're back. Okay, good.
Hmm.
You know, um, oh, it would have been dramatically different, George. Dramatically different. I lost friends, family, you know, suffered a lot of pain, emotional and physical pain. It cost me some years. There's no question it took some years off the back end of my life.
Yeah, yeah. Did it make your future more optimistic, do you think?
The procedures, the getting the
Yes.
SGB. Oh yeah,
Hmm.
definitely,
Hmm.
definitely. I mean, first getting off the meds, getting off the opiates and everything. All of a sudden, the cloud, that haze in your brain
Mm.
is gone. You can think
Yeah,
again. You can speak again.
yeah,
Okay. You're not numb. You feel emotion. You feel things. You feel hate. You feel love. You feel everything. That's a neat thing to have come back. You miss it. Then having a procedure that can eliminate or significantly reduce the more negative effects of PTSD without medication,
mm.
without having to take the SSRIs, without having to do this, is
You know,
dramatic.
I never heard of SGB therapy until you brought it up, and you had
Mm.
forwarded to me a video of Dakota with his doctor,
Mm-hmm.
and I was pretty blown away by it. It was very dramatic. I will put a link to that video down below so people can see this.
Yes, it's a good, and he has a
Why
foundation. Well, go ahead.
why don't people know about this? Why did I have to wait 60 years before I could direct people to this kind of therapy, being that it
Well,
is as effective as it is, and it has nothing to do with pushing pills?
it's a new therapy. It's the new application of like I mentioned, of an old procedure. Um, and so it hasn't been around that long. We're talking less than 7 years, 8 years.
Yeah.
And so it's now coming out there. I mean, the FDA has to kiss off on it, and doctors have to find out about it, and patients have to find out about it. And Dakota Meyer actually has a foundation now where they are uh, raising money for vets to help pay for these procedures. Um, there are people like myself that advocate and put the message out there. I'll go and
And
poke people.
thousands of people are going to hear about this after this video is completed. This information is evergreen. It is not going away. 1 year from now, somebody will be watching
Mm-hmm.
this conversation that we have and learn about this.
Mm-hmm.
What does a person ask their doctor for if they want to get SGB? Do they just say, I want SGB? Because I don't think every doctor would even know what this is.
Right. Basically, if you're going to go ask a doctor about it, now you can they're not common, but there are doctors that do this. My first thing would be to find a reputable pain management doctor or practice and approach them. They'll know
A pain management doctor is not an anesthesiologist, though.
A lot of them are, though.
Okay.
A lot of them trained up initially as anesthesiologists and then crossed over into pain management.
Mm-hmm.
But here's the thing. They're in pain management. SGB was originally a pain management procedure. Okay. So they'll be familiar with it. They'll know what you're talking about. They're not going to be going, SGB, what's that?
How is this different than a nerve block? I remember, my children were born with a spinal block and then a C-section. I've seen people get shoulder and elbow surgery after getting a block of some type. How is this different?
In a block, you're actually killing that nerve temporarily so that there's no transmission.
Okay.
And now I'm a lay guy, so I mean, my wife got an epidural too. She was running in the OBGYN birthing thing, going epi, and all I know was like, oh, you're putting that needle there, Jesus,
Yeah.
That's my experience. I've never had one. Here, you're not killing the nerve. You're stunning it. You're lowering it down, because the way the stellate is, like you say, it's a complex matrix of nerves.
Mm-hmm.
Okay, and so with PTSD, what happens is it also rewires into that stellate ganglion. All right, so they call it a block. I think that's this term of art or term for the procedure. But it's a
So
stunning.
it disrupts and kind of like rewires the circuitry, so to speak.
Helps do that, yes. And so that's a real positive there. And like I said, no side effects. Okay, I had hiccups. Trust me, we can turn on the TV right now and see side effects that, uh, sudden and onset diarrhea, death, appendages growing out your forehead, and that's just for something simple. This was, my insurance covered it. Okay, that was a plus. I have
this was done in a hospital or a doctor's office?
Outpatient surgical center.
Okay.
So not a whole-on hospital. The practice where I got this done through, and the doctor I got done through, they use a surgical center. They don't do anything in their office. Okay, because they like having everything there, all the equipment, and then if anything was to go wrong, they got all the equipment there, and they got doctor. It's as good as being in a hospital, pretty much. And so there's a safety, a convenience factor for the doctors, a little more safety for you, a crew that this is all they do all day. And so they're smooth as silk from the time you walk in to the time they're wheeling you out the door. I mean, my experience has been extremely positive with it. Okay. And so from that standpoint, from a consumer, it's a good gig. It was a good thing.
So I want people to listen closely to this conversation. I'm going to have people go to the Dakota Meyer video, which I'll put a link down below for that. You explaining it introduced me to it. The Dakota Meyer video really answered my questions about it. And then also, too, I think it was very helpful to, because people don't know what to ask for. And many doctors may not know what this is all about. If maybe the pain management guys do. But
now, understand, you're going to hopefully have a diagnosis of PTSD. You're going to know you have PTSD.
Yeah.
So your doctor, when you say to them, like you approach your doctor and it's like, I heard about this procedure. It's called a stellate ganglion block for PTSD. You know, it's in the medical journals. Apparently, there's stuff that can go look up. The doctors can, and everything, and find out about it. Obviously, your psychologist needs to know about it. Okay, and so you need to give them that Dakota Meyer. I found that Dakota Meyer video, the 60-minute video from 60 Minutes, very good. Explains it really, really well.
Yeah.
You know, and even the doctors are like it. And then, so you go and talk to them and they'll be able to look at it. Now, I was the first guy in Austin, Texas to get this done. I'm like patient zero. I'm the guinea pig. Okay. But I was at a point where if they would have said, John, put your head on the table, we're going to smack it 5 times with a sledgehammer, and this should take care of it. You know, right or left side, doc. Yeah, right or left side. And now the advances too in PTSD through the VA have been tremendous. They actually a few years ago, using modified, I believe it was MRI and CT, have found the particular spot in the brain that triggers the PTSD. It actually fires up. And so now they're researching that, and so they can actually get to the source, maybe organically.
So they've actually identified the hot spots through some type of imaging. That's pretty profound, and it's amazing. I mean, this is a fairly. I mean, they know that nerve altering and nerve blocking. This goes back many years, but this particular form of therapy. To use it in PTSD, do you know is there a crossover for bipolar or depression or any other mental issues? Are they?
Oh yeah,
they are.
Like I was telling you, the ketamine therapy is used for depression.
Yeah.
Okay. And I think the MDMA is also used. Bipolar, I'm not sure, but oftentimes there can be a diagnosis of PTSD and bipolar. Okay. And I think there are certain psychological conditions, mental illnesses, that make you predisposed to PTSD.
Yeah.
Okay. But that's more of I'm not really qualified to really discuss that.
This is quite amazing, and it gives hope to a lot of people, not only people who have been on a battlefield, but people who might be crime victims, people who've experienced some kind of mental trauma,
child abuse. You know, there's a whole list of things. You know, the history of PTSD, I guess, as long as there's been battle, there's been PTSD. You know, and World War One, shell shock.
Yeah, shell shock. Yeah.
And it was the French and British who noticed it and started developing treatments for it. The British, in particular. And then World War II, combat fatigue.
Yeah.
And on through. And really, it hasn't been until our wars in Iraq and Afghanistan. You know, we've sent 1 million people through that theater.
Yeah. It's amazing.
It's a lot of people. What, almost 19 years?
Yeah.
And so and so now it became an economic incentive to solve it for the government, because so
people
many
have to come back and function,
and
we can't.
too many disability claims and too many.
Yeah.
And so, you know, the great minds got to it, and it's really been in the last, I would say, 8 years that we've seen significant advancement and significant advancement in treatment. Not only understanding PTSD, but in treating it. The big takeaway here for me, if I'm talking to someone out there, is you're not alone. There is support. You're not going crazy. You can get help. There will be those who you can reach out and who will reach out for you. Your combat buddies, your brothers, your sisters.
Let me ask you this, John. When this video is published and people have any comments down below, would you personally respond to them? Okay, good.
Absolutely.
I would be directing them to you anyways. So, but if you don't mind.
I get about 40 or 50 inquiries every 10 days or so of people where I've posted and done things on other channels and sites and stuff, and made comments, and they'll come back to me, and you know, I answer every one of them, and you know, I'm available, because know, it's important to me. It's a way of me giving back. It's like, I went through this hell. Now I don't want you to go through it. Okay.
I think the next time we talk, I want to have a panel discussion. I think I'm going to maybe bring someone else on who has experienced it, and then a clinician who is actively treating. What I'm going to do is find a person who administers this therapy, and I will invite them on this broadcast.
I could talk to my doctor. Would that be
okay? That would be fantastic,
because they have it's sort of a they actually have a marketing group, and I'm actually in their profile. I'm on their web page as this, you know, the poster child for this procedure, and
fantastic.
I get referrals from them, you know, to talk with people, and so it's an important thing, and I think now with what's going on in our country and around the world, actually, I think, unfortunately, sadly, the incidence of PTSD will just increase. And if you can nip it in the bud early, if you can get to it early, it makes a huge difference. See, mine set in for 5 years before anyone, you know, so it gets entrenched. I mean, you know, it becomes part of that thought process.
If one person watches this video and gets help, then it's been worth it.
Absolutely. And I want to thank you for giving me a platform to come out and talk about this. Thank you, George.
It's important, and your voice is important in the I guess for lack of a better term, the PTSD recovery world. And what I'm not preaching is your confirmation bias, which would be like, hey, if I can do it, you can do it. You go way beyond that. You're giving hope to people that it can help people who have the worst of the worst scenarios. And yours definitely was, in all of my clinical experience, one of the worst scenarios that I've ever seen anyone survive. I don't even know how you could have a conversation. A lot of people would lose their marbles forever as a result of that.
Well, I guess I don't know what to faith, character, luck.
Yeah.
Yeah. I'd be lying if I said I don't know. I know what gun oil tastes like.
Yeah.
Okay.
Well, you are alive, and
yes,
you will survive.
And I'm gonna stay alive. I'm gonna be
like
the
that.
hardest guy in the room to kill.
I like that. Be hard to kill.
Beat me, kick me, make me write bad checks in the morning, man.
that might be the title of the next video. Be hard to kill. John Hoover, thank you so much for bringing this topic to light. A lot of people are going to be helped. Everybody knows somebody who has a form of PTSD, whether it be a father, a brother, a friend, and an undiagnosed form of PTSD, and they're suffering. So thank you so much today for sharing that with us, John. Thank you.
And thank you for giving me the platform. Everybody, be strong. Be good to each other. No exceptions. Talk to you later, sir.
Take care.